Hi, I'm here to review this twin Stim OTC TENS unit. Now, it comes with 4 of these patches. You need to have at least 2 patches on at one time in order for the machine to work, because it's a safety mechanism that protects you from getting electrocuted. Then you have your power pack right here, and this operates the different modes and the strength and the setting. The maximum suggested use is 30 minutes. Now there are different modes that it has. I have it on the burst, which gives you 10 pulses per burst for a half sec, and it says 0.5 to 5 bursts per second. So half a burst to 5 bursts per second. And you can set the width and the rate, and you can adjust how strong it can go up to an 8. I have it on a 2, and it feels pretty good on a 2. On a 3, it starts stinging a little bit. Oh, I can't get past a 4 with this on my lower back. I wouldn't even try to go up to an 8 on this. That would definitely hurt. So this thing is very powerful. Be careful with it. Make sure you don't have it set on 8 when you cut it on or whatever, so it doesn't hurt you. And if you decide to move the patch to a different area, cut the machine off before you try to remove the patch and switch to another area. Do not put the patches near your heart. Do not put both patches on your feet. Do not put both patches simultaneously on your thighs. Do not put the patch anywhere near your head, neck, or throat. Do not put the patch anywhere on any of your pulse areas, like your wrist or anything. The main areas that the patch is good for is maybe both of them on one thigh, uh, both of them on one foot, or on the lower area part of your back, too, at the same time. But other than that, there's not too many more places that I suggest it, because it's electricity and it can mess with the electric part of your heart and cause you to have a heart attack. And you don't want to die from using this trying to get pain relief. Now, on the set mode, it's got a width, so you can adjust how strong it goes across. The maximum width is 300, and at 300 I can feel the pulses going all the way across the whole part of my back. When I make it go down to 60, now I can barely feel it. Now if you had the width on 50, you can increase the intensity a little bit more and it not hurt as bad. With the width down, I can manage to get it on a 4. But please be careful with this. I don't want you to have it on a high width and then put it on a high intensity and hurt yourself. Now I'm going to try different settings. Let's see. You hit the mode. Now I have it on normal. Normal feels like a tap, 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 tap. Then modulation. That's 50% of set width and 50% of set rate. So you have, right now it feels like kind of like a tap tap tapping, but it's slightly different from the normal. Then SD1 strength duration, that does 10-second pulse. This may explain it a little bit better. That's the SD1, I have it on now. And then SD2. And then you have the synchronous. That does it a little bit, stops and then does it a little bit, and then you have the alternate. And that shows you the pattern of it. So altogether, 1, 2, 3, 4, 5, 6, 7 different modes. And the width goes anywhere from 50 up to 300. Cut it back down. I just cut the width up to 140. Had to cut the setting down to 3. But anyway, that's the TENS unit. It's great for cramps or muscle pains. It's not going to cure any disease or fix any illness. So if you have arthritis and you need, or you have some kind of chronic pain and you need medicine for it, please do not substitute your medicine with this machine. I hope this review helps. Thank you for watching. Bye bye.